name is Bradley Childers, and I'm doing a head, ear, eyes, nose, and throat assessment for SBU's health assessment class. So this is my patient, Austin, but she is in her patient's room right now. So before I go in to my patient's room, I'm going to gather all my supplies. I have my stethoscope, which I won't be using today. I have my otoscope, and I am going to perform hand hygiene before I enter the room. And I'm going to provide the patient with privacy by having their door closed. And I'm going to knock before entering, and I'm going to keep the patient covered as much as possible just to help them feel more secure and safe in the environment and with me. So I'm going to go ahead and knock. Hello, Austin. My name is Bradley Childers. I'm going to be your nurse today.
Hi, Bradley.
And upon entering the room, I am going to assess the patient's how she appears to me, her appearance, her physical appearance, if she has any deformities, how she takes care of herself, how she speaks to me. As we enter the room, we can see her arms are crossed, so she may be a little standoffish, or just a little unsure, or a little cold in this case. So I have greeted the patient. I don't see any physical deformities. She looks like she's in good hygiene and good health at this point. She's well dressed in Mercy apparel, with her jacket, which is appropriate for the season for wintertime in this cold house. She's clean, well put together. Her skin color is pale and pasty, which is appropriate for the winter time. Her posture is good. She's sitting nice and tall. She's holding her shoulders back. She looks like she has pride in herself and carries herself well. She has a good affect. She has a good mood for the situation that she's in. Her speech, we will assess here to make sure it's clear. Austin, are you having any hearing difficulties?
No.
Are you having any speech problems?
No.
I hear a little bit of a lisp. Is that something that is...
I have new retainers.
You have new retainers, okay. So Austin's working on her physical appearance with retainers, or Invisalign it looks like. And Austin, how's your appetite been? Have you noticed any weight loss or gains recently, or had any problems with your diet?
And about the same.
About the same, okay. What's your diet usually consist of? Is it a fairly nutritious diet, or is it mainly consist
Fairly,
of
but tonight
Oreos?
I ate Chinese food and Oreos for dinner.
Chinese food and Oreos. So we'll provide her a little education later on about some healthy food choices, primarily to stay away from Chinese chicken and Oreos. So first we're gonna start with head and face assessment. She maintains eye contact with me as I enter the room and start my observation of her. She's oriented, it seems like. Austin, do you know where you are this evening?
I'm at home.
Okay. Hopefully you're in the hospital.
I'm in the hospital.
Okay, so she may be slightly confused at this point. We'll have to look into that. Do you know what today's date is?
It is February 4th, 2016.
Okay. And do you know why you're in the hospital?
I'm here for a checkup. I'm not in the hospital.
Okay,
I'm at
so you're
my
in the
doctor's
clinic.
office. Yeah.
Okay.
That's where I am.
Okay, you're in the clinic. Okay, so Austin is in the clinic with us today. Okay, so first of all, I'm going to ask you if you'll let down your hair for me. I am going to perform a inspection on her head and her scalp. Sorry, I apologize. Alright, so I'm going to put on my gloves after I perform hand hygiene. Is it alright if I touch her head? Alright, so first I'm going to feel her head, feel for any abnormalities, bumps, lesions. I'm going to look for any bruising. Her hair looks good. There's a slight bit of graying, but I'm unfortunately looking for any bugs as well in case she may have lice or something. But I don't see any bruising. I don't feel any lesions. Have you had any headaches recently?
No.
Have you ever had a head injury of any sort?
No
or
head
surgeries
injuries.
on your?
No.
Okay. So now I'm going to observe her face. I'm going to look for symmetry from side to side between her eyebrows and her eyes and her mouth. Look for any facial droop or any scars or any sign of any nerve damage. Her ears are level from side to side. Let's see. Next, I'm going to feel the temporal artery here. That feels good. I'm going to feel her joint here, her mandibular joint. Can you open and close your mouth for me? Do you have any popping?
No.
No. Doesn't feel like it. Okay. And do you have any, are you having any sinus issues?
I have some pressure.
Some pressure right in here? Okay. Alrighty. So now I am going to assess Austin's eyes. I'm going to assess her peripheral vision, and her reflexes as well, and some of her nerves. We'll also perform a cover test, and we'll talk through the Snellen eye chart here. So I'm going to go ahead and pull out my pen light. We'll use this here in a minute. So I'm going to test your peripheral vision now, and if you'll just look straight ahead and just tell me when you see my fingers come into view. Okay, you can see them? Okay, good deal. So she has good peripheral vision. I'm going to check her corneas and pupil reflex now. So I'm going to shine a bright light in your eye. If you'll just look straight ahead for me. I'm going to check to make sure this left pupil constricts. I'm going to look at the right pupil. It constricts as well. And I'm going to check to make sure that the right pupil constricts when I shine the light in the left eye as well. Alright, so both pupils are equal round and react to light and accommodation. Are you having any double vision or pain with your eyes or anything? No? Okay. So now we're going to check her eye movement. I'm going to just have you follow my finger just with your eyes, not moving your head at all. So now we're going to test her eyes with our finger moving towards her. So you may go cross-eyed here a little bit. So just focus on my finger as it comes into you. All right, great, good deal. So now we're going to do the cover test. I'm going to ask you to just cover your left eye first with one eye and just stare straight ahead for me. And then I'll ask you to remove your hand. And here I'm looking to see if we'll try it again here. If you can still look straight ahead for me. Are looking for any drift between the eye that's covered to see if it drifts off as she looks straight ahead. Okay, good. And the eye stays straight. Now we'll try the other side and go ahead and remove it. And her eyes stayed straight. Yeah, the one that was covered up did not drift at all. Now I'm going to look at the external structures of her eye. I'm going to check the sclera, conjunctiva, make sure there's no scleral edema or anything such as that. Just look straight ahead for me. Her eyes look good. They're slightly reddened. Austin, do you have any allergies? So potential allergy there with her eyes being red and.
And I'm tired. When I'm too sleepy, they get bloodshot really easily.
Okay, so she is tired. Have you worked today? Okay, so looks like she's coming off of work, pretty sleepy and tired. So that mixed with some allergies may cause some eye irritation there.